Fuck, I hope I don't fuck up. Ready?
Yep.
Welcome, ladies and gentlemen. We are students of Global Health at ACPE. This is Fabian, that's Luke, and I'm Steve. The purpose of this presentation is to provide insight and development in global health concerns within the Western Pacific region. The focus for this pitch is to ask for funds to alleviate, as a primary focus, the burden of diabetes on the Western Pacific region. This proposal is asking for $910,000 for a 2-month startup and an initial program or initial location based in Fiji. After the 2 months, the aim is to have sustained funds from local government, NGOs, non-government organisations, and non-for-profit businesses. We will endeavour to unpack the health issues and concerns within the Western Pacific region, as well as provide a sound plan of implementing the Western Pacific region Diabetes Educational Institution. Fabian will unpack the health concerns and risks in relation to the SDGs. Luke, being our financial planner, will run through costs of the project, and I will discuss the implementation and development of the program. I will pass you on to Fabian for the next segment.
So here's the map of the Western Pacific region. That's all the countries which are part of the Western Pacific region here. Australia, Tonga, Fiji, and so on. Low to middle income in Western Pacific region. So the information is, the location is in the South Pacific Ocean. That's World Health Organization's Western Pacific region. It has 100 inhabited and 200 uninhabited islands, and extended is over 18,000 kilometers square meter. The population, it is home to 884,887 people in 2017, about 56 live in urban and 44 living in rural areas. The annual population growth is 0.6%. Median age is 27.5 years, and 69% of the population is 40 or under in 2017. The ethnicity, indigenous Fijians equal Fijians, Indian equals Indo-Fijians, that's 46.2%, and minorities, Europeans, past Europeans, road to men, and Chinese, which are around 3.9%. The economy, although it is most developed Pacific Island economy, Fiji remains a developing country with agriculture, forestry, and fishing as main industries. Its travel and tourist industries are growing rapidly. Social, cultural, political, environmental, lifestyle, and economic causes of health issues. Cultural and religious views, that's big body size equal health, power, wealth, strength, and hard working. Food and money are forms of religious giving. Hosts will provide guests with ample of food and drinks. As a courtesy, Fijian guests will drink, eat, or they are provided. Political crisis. a British colony is about 100 years until 1971. Political unrest with social and economic instability and international sanctions. International sanctions from 1987 and 8 years of military rule until its independence in September 2014. Environmental factors. Each year from November to April, Fiji is prone to cyclones and floods, destructions to homes, water contamination, and dire horrors. Poverty and urban living. Rural dwellers are relocating to urban areas because lack of primary healthcare facilities and sanitation, scarcity in safe drinking water, and nutritional deficiencies in poor rural households. Overcrowding and poor housing conditions in urban areas are linked to poverty and urban living, and low income or unemployment together results in poverty. As from MDGs to SDGs, global MDGs achievement up to 2015. HIV, tuberculosis and malaria have met the targets. 53% and 44% reductions in children and maternal mortalities respectively compared with 1990. New interventions and vaccines availability against pneumonia and diaphragm diseases. Improved diagnostic tests for multiple diseases. Strengthen commitments from both public and private sectors. 10% decrease in extreme poverty and undernourishment in developing countries from 1990. Almost 50% reduction of open defecation. Over 90% of girls and boys enrolled in primary schools. 91% of population have improved drinking water sources. Global MDG targets yet to attain, and they are basic for SDGs. Family planning and improved sanitation. MDGs related to healthcare. Global SDGs 2015 to 2030, which is the target they're hoping to. While there were SDGs, there are 17 MDGs. And they're talking about environmental poverty factors, and it's hoping to promote fairness and peace among communities. Where there's no, hopefully there won't be any violence which will occur, but encouraging cooperation between the rich and the poor countries. The difference between MDGs and SDGs. SDGs bind developing countries to help developing countries through health funding. SDGs focus on every country and all mankind. SDGs stress on the maintenance of peace and security.
So as you can see, leading causes of death in this chart for the Western Pacific region is diabetes. Right? This is going to be our main focus for our educational institution, with tuberculosis potentially being the next one that we want to try and implement. as a lot of other countries within the Western Pacific region also have those health concerns.
Population health, a relatively healthy population through NCDs are decreasing. Life expectancy for men was 67 and women is 73 in 2015. Adult mortality rate from non-communicable disease at ages 30 to 69 was around 31% in 2015. Maternal mortality ratio was 30 per 100,000 live births in 2015. Under 5 mortality rates was 22.4 per 1,000 live births in 2015. 25.7 of the tobacco smokers were 15 years of age in 2015. Tuberculosis, 51 tuberculosis incidents per 100,000 people. That's i.e. 452 tuberculosis incidents in 2015.
Keep going, just keep going. We can trim it out after. Right? You just got to keep going. Never mind, forget it. Back it up. So the Western Pacific Region Diabetes Educational Institution is an innovative program. Right? This is looking at coming after diabetes from a public health perspective. So this is all curriculum based or curriculum focused, with the idea that it is trying to engage community members, health professionals, and of course members of government, organisations, and non-for-profit stakeholders. If we look at it, we're going to look at a more preventative type of philosophy rather than just a cure based. This comes into the approach later on that I'll go into. However, we do also want to try and find funding for these 3 key points. Educators, obviously, they're really important when providing educational information on diabetes. Sporting equipment, which we'll get into later for our second part of our program. And of course, advertising and making sure we get our point across and we start trying to get people active in the public. So the approach. This is how we have devised our plan on how we're going to implement this educational program. We have 3 pillars. I like the idea of having this cog because it sort of looks like without one, we can't focus on the other, right? And it all sort of builds in and comes together. So our big cog down the bottom is our education and development. This is really important because this is a public health initiative. We're trying to get more awareness, right? This is how we focus on it. We're going to have seminars on type 1, type 2 diabetes. Type 2 diabetes being the one that is more lifestyle based. It's the one that people are more prone to and is the one that can be prevented by good healthy behaviour. Right. We're also going to look into seminars of how do you get it. So within the specific seminars, you'll be able to sit down, you'll be able to understand from health professionals what it is that you're doing wrong, what it is that is affecting you, and how you can go about making a better decision. And then finally, as stated before, a preventative/cure. Right? With this initiative, we're looking at more the preventative side. So So if we can implement this on a public scale, we'll be able to not just influence one individual or two, we'll try and get the big outreach going and try and really tackle this from a good perspective. Our second cog is preventative treatment. So this is focusing on that preventative side. When you look at it, it's maintaining healthy weight. Right? That is something that we've looked into, and I'm sure that the educational leaders within this institution will hone that through as well, that if you're at good healthy weight and you're doing the right things, as well as nutrition and lifestyle factors, you're going to be setting yourself up nicely if you do have type 2 diabetes, right? And you'll also be looking after yourself if you have the hereditary type 1, or if you're just trying to make sure that you don't then are susceptible to type 2 diabetes. This is now more of the practical side of it, or it leads in and transitions into the practical side, which is our practical implementation. We decided to try and implement this into our program. This added a bit more funding. However, I do believe this is a really good cause because we're starting to build exercise programs. What we tend to find, and within the information that Fabian has provided us before, right, it's very hard for people in this region to understand those consequences. Right? We're a little bit limited by how much education we have down there, and we need to make sure that we really try and hone this idea in. We have PTs that we're looking for, which Luke will then delve into later on in our financial stuff, right? And we need facilities for physical activity. Right? Activities specific to the population areas, because this is our first initiative and we're looking to base this in Fiji. Obviously our facilities and our activities need to be based culturally, so making sure that we are sensitive to their beliefs, as well as making sure that we're trying to get through this preventative treatment and getting through these initiatives. So these are the goals that we want to set up for our program. Right? As I said before, we focus on the preventative aspects, right, and creating global health awareness. So if this works out in Fiji, we're looking to implement this in Tonga, we're looking to implement this in other Western Pacific regions and trying to eradicate this whole thing. So what we came up with, we sat down, we focused on it, we thought about it, we thought long and hard, we said how about we focus it into 3 main points or 3 key goals, and if we can tick all them, we'll know we're on the right track. Our first one is providing concise educational information. So within the seminars, we're making sure that we're providing really strong, confident health professionals that are going to make sure that our point comes across and that people within those regions understand what the health concerns are and how they can do it. Right? It also leads into the fact that we need to provide proper theoretical, we need to be developing and continuing our research into diabetes and how to prevent it, as well as providing the practical tools like your facilities, like your PTs that can then come out and try and build people's confidence, get them moving, get them involved with their health, right? Allow them to have ownership for what they are doing to their bodies. And our final one is sustained and continuous development, as I said before, and that works for both physical and educational.
So I'm going to be looking at funding in the Western Pacific. They have a big problem with diabetes, and it has a great impact on the health of the region as a whole. Education being our main focus, I'd like to propose a plan for the funding needed to combat this major issue. We have come up with a plan for initial 2 months with education at the forefront. We believe that this education can be carried out in a number of effective ways and can better educate and therefore better the health of the region. Our education program involves first the employment of diabetes educators to go around and educate in schools, workplaces and seminars around the Western Pacific. These educators will have content, resources and advice to combat this issue. We believe that this education will help the community and region understand the prevalence of the issue and will further educate them in the ways it can be stopped and combated in their homes and on a larger scale in the region. Schools are seen as being very important as it influences the younger generation and may kickstart change in this unhealthy and dangerous lifestyle. Along with these educators, we will have personal trainers teaching proper exercise techniques and ways to keep fit and healthy throughout physical exercise programs. This will be done in schools, in the workplace, and in seminars around the Western Pacific. They will teach and carry out these fitness programs. With obesity as a massive problem in the Western Pacific, and the way it is linked to diabetes, it is very important that the population is educated on how to exercise properly. With 25 personal trainers and 25 diabetes educators, coming to a total of 50 employees travelling in the Western Pacific. For 2 months, with a focus on education, the wider public, through schools, seminars and workplaces, we would need roughly $550,000 to fund them for that initial 2 months. The personal trainers and the diabetes educators will need equipment for their seminars and activities to help in their various demonstrations and classes they will need to perform. With exercise equipment for each personal trainer and diabetes educators, we would need roughly $60,000 to equip them all. Our last strategy being advertising, we believe that with correct advertisement campaigns, we can reach out to all parts of the Western Pacific and further educate them in this way. Our education methods are looked at in different ways, with billboard advertisement, with television advertisement, flyers and radio advertisement. The advertisement would be to notify the region of the seminars and personal training classes, as well as using the advertisement to educate the region on the problems, the facts, the statistics on diabetes and how it is and will affect them or someone they are close to, and the different methods to combat diabetes. These methods are seen as very effective as they can reach and influence a large audience and is done efficiently. Many different messages can be conveyed through this advertisement and will educate those viewers. With all advertisement paid and set up for 2 months, we would need roughly $300,000. In total, for our education program to go ahead, we would need $910,000 in funding. As you can see on the table here, that's the funding that would be needed.
Diabetes is a disease of largely lifestyle, which is the most prevalent cause of disease in Fiji. In 2015, around 20% of the deaths in Fiji were diabetes related. In Cambodia, the situation is
It's the same sort of thing. Just keep going.
Tuberculosis, which is a contagious disease, is a productive of adverse living environment. There were 51 cases of tuberculosis per 100,000 people. As members stated in WHO, World Health Organization, Western Pacific region, although we are far apart in location, we are both committed to tackle the same health issue, which is tuberculosis and diabetes. We believe that by joining hands, we could directly meet the following 2 SDGs, as well as indirectly helping reduce poverty and inequity, ensuring availability and sustainability management of water and sanitation for all, reduce health inequity within our countries, joining partnerships between our countries which allow us to share knowledge and skills as well as learning experiences of one another. With $1 billion US money in funding support from World Health Organization, we could each raise up to around $50 million US to make the proposal plan viable and sustainable. Our successful joint venture could set a repeatable example for other countries to follow. Please support our countries. Please give our countries a chance to take responsibility to look after especially our vulnerable. Thanks for listening, everyone.
Thank you.
What was that slide which we skipped?
Say anything until we turn off.